Today marks a pivotal moment in our healthcare system. It's where we're advocating to choose people first over insurance company profits. It's essential to underscore the fundamental principle here. Patients' needs must come first. Last November, I hand-wrote a law before it was politically popular and before it became a national news headline, because what was occurring was simply wrong. It wasn't right, and it was part of the foundation of why we're here today. So let me share a personal story with you that deeply resonates not just with me, but with other families across the south suburbs in this cause. My daughter, Maddie, who some of you have known when you guys were taking care of my family here, she ran around the hospital. She was brought into this world through in vitro fertilization. Her arrival has brought unlimited amounts of joy to my family and to a lot of other people as well. It was a journey, though, that was riddled with uncertainties, delays, and bureaucracy. It put an immeasurable amount of stress onto our family, and any delay in treatment would have altered the course of our lives well into the future. Across our state, there are insurance companies who dictate not only to women, but to families across the state of Illinois as to what their treatment plan should be, whether it be for in vitro fertilization or any other healthcare treatment, that being mental health or cancer, ultimately ignoring a doctor's recommendation. If a doctor says a family should go through in vitro fertilization or another medical procedure, an insurance company should not say, well, you got to go through steps 1 through 10, and then we'll talk about it, ultimately delaying the blessing of having a child or seeking any other mental health treatment or medical treatment for that matter. And this happens every day here in Illinois. When insurance companies' profits and policies supersede the most important parts of the equation, that being the doctors and our people, that's a problem. So whether it's a neighbor, a member of our staff, even legislators who we don't see eye to eye with, the bottom line is that insurance companies don't discriminate when it comes to making a profit, and families should not have to live beholden to their insurance company when it comes to family planning, reproductive rights, or any other treatment plan that's prescribed by a doctor. I'm just going to say it the way my neighbor said it. The insurance empire bureaucracy is a nightmare. And I get a lot of up and downs in the crowd because you all agree. By championing this legislation, we're taking a critical step towards healthcare systems that prioritize patients' well-being over the bureaucratic red tape. Together, let's ensure that no family has to encounter these needless delays when it comes to accessing healthcare that they desperately need.
When you look up my Senate bio, one of the things that's been on there since I became a senator was patient advocacy in the healthcare system. I'm thankful every day for the network of family and friends that my wife and I have. This network is what sustained us through some very difficult times with our 2 youngest children. In 1994, my son was born with truncus arteriosus type 3. There's a few doctors that might know what that is. It's a rare heart malformation that required open heart surgery at 2 weeks old, again at 4 years old, and yet again at 14 years old. Countless MRIs, echocardiograms continued. He had a Melody valve at the age of 26. He's currently 30. We know he needs continual monitoring, and yet pre-authorizations are necessary for insurance coverage. His condition is not changing. These cardiologists' required tests set benchmarks as to the urgency of his next procedure, period. He is examined on a regular basis by trained professionals. Pre-authorization again and again can be very frustrating. When we thought our prayers were answered and tough times were behind us with our son, our daughter was diagnosed with AML leukemia in 2010. 7 chemo treatments, 2 stem cell transplants, surgery and radiation for brain tumors, and a 2-year battle in hospitals more than out, found us fighting for coverage and pre-authorization for better nausea medications, injectable blood thinners, an MRI here, another day in the hospital there. Our fight to keep her morale up, to stay strong, we're divided to fighting for better medication and different procedures. We saw how effective a nausea medication was after chemo number 2. And when chemo number 3, severe nausea, landed my daughter in the hospital for 4 extra days, we were told that that medication wasn't currently authorized. It took years to sort out the coverages after Katie passed. If you don't have a network of family and friends, I refer you to the beginning of this testimony, who advocates for you. You're out there by yourself. This piece of legislation is a step in the right direction to advocate for Illinoisans' healthcare needs.
Predatory practices within the insurance industry have long been a contentious issue, particularly in the realm of healthcare. These practices aimed at maximizing profits at the expense of consumers' well-being underscores the urgent need for regulatory intervention and reform. First and foremost, access to healthcare is a fundamental right. Access to healthcare is a fundamental right. Yet, insurance companies often erect barriers that impede individuals from receiving necessary medical care. This can manifest in various forms, such as denying coverage for pre-existing conditions, imposing exorbitant deductibles and co-payments, or limiting network providers. Such practices disproportionately affect vulnerable populations, including those with chronic illness or low incomes, exacerbating health disparities and perpetuating inequalities. Addressing these predatory practices require a multifaceted approach, one that is found within the Healthcare Protection Act. We must hold companies accountable for unethical behavior and bring forth transparent practices that mitigate the influence of profit-driven insurance companies, ensuring that healthcare is treated as a public good rather than a commodity. Ultimately, tackling predatory practices within the insurance industry is not just a matter of economic efficiency, but one of social justice and human dignity. I look forward to working with my colleagues and stakeholders to get this legislation over the finish line in the Senate. You can depend on us to deliver in the Senate. It's past time that we safeguard access to health care and curb corporate greed. Together, we can move closer to creating a healthcare system that prioritizes the well-being of individuals and communities over profit margins.
We are one step closer to bringing comfort and dignity to healthcare patients all over the state. I am no stranger to our healthcare system. I was born hard of hearing. I've had multiple surgeries throughout my life. I've struggled with mental health issues. I've seen these struggles with friends and family. And in my 20s, I've lost one parent to cancer and another to alcohol abuse due to her coping with her own mental health trauma. Like so many of my constituents, I know the anxiety and fear that comes with navigating our healthcare system, especially right now as my wife and I are looking to have children in the near future and are doing fertility treatments. It is hard enough trying to navigate the day in and day out of life, whether that is taking care of friends and family, taking care of work and home chores. It is understandable that a bunch of healthcare papers and policies can add even more anxiety to your life. I have a unique district. It stretches from downtown Chicago through the south side to the Indiana border. It is home to large health systems, a public health system, safety net hospitals. It is also home to people who live across spectrums, particularly across race, class, and gender. But one thing that is nearly universal is people who have felt pain when it comes to their health insurance. What we are doing here is fighting for the everyday Illinoisan, the one who wants to make sure that their loved one, or even themselves, is receiving the best care possible. That when your doctor recommends a treatment, that is the treatment that you get. That when your child is facing a mental health crisis, they get a hospital bed that is filled with love, safety, and comfort. That finding a provider or a plan isn't a guessing game for your well-being and your wallet, and that you aren't fooled by predatory companies masquerading their financial scams as insurance plans. This bipartisan bill is coming to the Senate, and the big-time insurance companies are going to do all they can to fight back. They're going to throw out every scare tactic in the book, and we have made it clear. The door is open, and that advocates as well as opposition are able to give input on this bipartisan bill. And just want you to know they have given input. Everybody has. This is the process, and it's been amazing work by the governor's staff on this. What we've done and what we are doing is bringing the people of Illinois with us to the negotiating table. We will get this done. We will continue to make Illinois a healthier and safer place. And I'll end on this. Thank you, Governor Pritzker. I'm honored to sponsor this bill, but I know I am not alone on this. So many leaders and colleagues have worked tirelessly and personally to change and improve healthcare outcomes in the state. When we get this done, it will have been all of us who have been committed to our constituents and ensuring they have the best care possible.
For too long, insurance has dictated healthcare, but I'm not sure we should call it healthcare if it denies care in the name of profits. So I want to give you a peek behind the curtain on the other side. When I finished school, I got my degree in mathematics, and I went and worked for an insurance company. I initially worked for health insurance and then later life insurance on my path to becoming an actuary. My job was to look at the data all across the networks that we had, a lot of them being here in Illinois, and decide on zip code and doctor rates and hospital rates. Was this a hospital or a provider that was worthwhile to be in our network? And what that meant was I had a standard in which I had to decide, could we make enough money off of this? If we didn't even come close to breaking even, we immediately dropped those providers and hospitals. In some areas of the state, that could completely put a hospital out of business. In other areas, our standards needed to be well above 20, 30, 40% profits. That was 20 years ago that I worked for an insurance company. I left that field because I felt I was selling the parts of my soul away for somebody else to make trillions of dollars while we denied coverage to people who really needed it. So I am very much in support of this bill. I want to tell you a story that just happened last night. Someone who was telling me, and I'd like to say that this is a rarity, but unfortunately I hear stories like this all the time. So last night I met a woman who was telling me that she was 10 years sober from a substance abuse. And I was so congratulated for her, and she was telling me her story and her process and all the health care and the mental health that came about. And now, 10 years later, she needs to have a routine procedure, and it needs some pain medicine to it. And so when she was working with her doctor and said, the 2 medicines you want to give me for this procedure would put me back on a path that's taken me 10 years so that I can be sober. And the doctor said, I will work with you. We will get an anesthetist in here to help you in this journey. Only to find out that her insurance denied that that was not the step that she needed to go through. She needed to use this medication. Now, there was no way that insurance company knew that woman's personal story and the journey that she had been on. But her doctor knew it, and the staff knew it, and they were willing to work with her from a human level of really providing the health care that she needed. That is what this bill is going to allow us to do. Give the power back to patients, to doctors, to their staff, who can make those decisions that are best. It is time that insurance stops practicing medicine without a license, because that is exactly what they have been doing.
Thanks for watching this video. Please like and subscribe to keep up to date with news from the caucus. For more information on what the senator is working on, you can follow them on social media using the links in the description below.